Jaben here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. In today's video, what about the recent CDC guidance change regarding the 15-minute time threshold for close contacts? Well, last week, the CDC came out and said the 15-minute time threshold can be cumulative, so that it's not just 15 minutes over one interaction, but it could be cumulative over multiple shorter interactions. Actually, what they said is that the close contact should now be considered if there's a cumulative exposure to someone who is positive, 15 minutes in a 24-hour period. Of course, exposure to a pre-symptomatic person, someone contagious for a couple days before symptoms start, that happens whether you know it or not, and whether that exposure is one-time or cumulative. This change from the CDC was actually suggested first a couple months ago, but not adopted by either the state or Haywood County. But it is now adopted by the state, and it stems from a single case study in Vermont where a correctional officer caring for 6 inmates, each awaiting COVID test results, also ended up testing positive, even though he did not have a single 15-minute exposure. When they reviewed video, he had multiple interactions within 6 feet, totaling 17 minutes altogether over a shift. The officer was always wearing a mask, but the inmates not always. So the current criteria in Haywood County for a close contact that would require someone to go into quarantine is within 6 feet for more than 15 minutes without a face covering. And given that, over the past 60 days, of 373 close contacts in quarantine, only 38 have become positive. That's roughly 10% of close contacts by the criteria we have been using. And included in this are 2 situations locally where people sharing an office got infected, with no single contact longer than 15 minutes, but where people were in and out and where masks were not being worn consistently. So we have local experience to perhaps go with the case in Vermont with concern about cumulative exposure. But if we examine closely, look, exposure to pre-symptomatic people, inconsistent mask use, and a high viral load. I mean, after all, the officer was around 6 people who it turns out were infected. And as we've talked about the higher the viral load, the bigger the chance for the virus to get on you and in you and overwhelm your immune system's ability to fight it off. So here in Haywood County, the nurses doing the interviews of positive patients will continue to apply the current criteria with an extra eye out for those situations where cumulative exposure might be in play, as they have already been doing. And for each of you, nothing really changes. Continue to avoid being in close contact. It's your best strategy. Use the current criteria. Avoid being within 6 feet for 15 minutes and wear a face covering. What might change for you is this. The advice all along has been to avoid crowds, especially indoors. And this just reinforces that as a higher risk environment with a higher possible viral load and a higher chance where cumulative exposure might be significant. And this also emphasizes that these criteria are not an on and off switch. They're more of a dimmer switch. The closer you are to the thresholds, the higher the risk. And the more you compromise one factor, the more important adherence to the others become. So be well and be careful. Practice actions that safely protect you and those around you, especially right now.